Good morning, public speakers. Today in the United States, we operate off a private healthcare system. This means that Americans without the income or socioeconomic backgrounds cannot afford the basic healthcare for the everyday emergencies or their routine medical needs. This means that there are millions of Americans right now during a COVID-19 pandemic that cannot receive testing or treatment because they simply cannot afford the medical coverage to do so. This means that whole families are going untreated and uncared for in America today. In 2018, 8.5% of the population was uninsured. Now, this seems like a small number, right? Well, that means that 28.5 hardworking Americans will go uncovered and uninsured for a pandemic that has a 100% infection rate. The other big problem is that 55% of America is covered under their occupation. Now, what this means is that on Monday, 10 million unemployment claims came through the federal government, meaning that there are 10 million people possibly without health insurance right now. You see what I'm getting at? The need for standardized health care, or at least affordable health care, is very apparent in these economically rigorous times. So we know the problem, right? Normal average Joes cannot afford the health care that they need. Now, the solution is complicated but pretty simple: wealth distribution and appropriate budgeting. By taxing the wealthy of America and using some of our trillion-dollar defense budget, we as a society could completely turn around our healthcare structure and circumvent medical debt and the overuse of hospitals by people who are uninsured. Members of the Senate, led by Senator Bernie Sanders, have championed ideas like this one and even put together a comprehensive plan to give health care to all American citizens. This is known as the infamous Medicare for All bill. Now, what does this plan look like? This plan would provide each individual American citizen without health insurance a Medicare card that they could then use to receive treatment at approved government healthcare facilities. Now, each state would run their own government hospitals or healthcare clinics, and this would all be overseen by the federal government to ensure that the people got the right healthcare that they needed. The federal government would also manage its reserve funding for natural disaster relief and for pandemics like this one. They would also use that money and time to pioneer new and effective treatments that could be then implemented at the lower levels. Now, the money would be taken out of the defense budget and also taxed from large corporations, wealthier Americans who make above $10 million a year. And this healthcare plan would also not be an all or nothing situation. Excuse me. They would be able, if you had health insurance already, either through your occupation or had already previously purchased it, you don't have to get the new Medicare card at all. You can still use your own health insurance. But by these people paying just a little bit of money from those taxed health insurance, they would be able to provide health care for almost all Americans who can't afford it. This would also allow for testing for COVID-19 patients all over the country free of charge to help curb the problem of the global pandemic. The problem is in a unbridled capitalist society, we tend to think of ourselves and not others. And we forget that there are people right now who can't go to the hospital for COVID-19 because they cannot afford the astronomically high bill that would be charged to them after they went. And is that what every person deserves? To be thrown out on the street and not taken care of? Absolutely not. And these people who can't afford health care, these are low-income families who are working multiple jobs just to afford rent and enough food for their children. They just simply cannot afford the thousands of dollars it takes to buy total health care coverage for their family. And that's why in a pandemic like this one, it's important that we bring this issue to light so that members of Congress and members of the federal government will understand how we need health care right now. And that's why we need to step in as an incredibly wealthy society and change the way we view people. Instead of dollar signs and health insurance policies, we saw them as human beings in need of help. So that's why in these upcoming months, as the pandemic gets curbed or doesn't, that is brought to light that we need affordable health care for everyone. And that the federal government needs to step in and step up to help provide health care for all Americans to save lives during the COVID-19 virus. Thank you for listening today, and please stay safe, wash your hands, and don't touch your face.